I'm Jack Newland.
And I'm Hannah Cummings.
And this is our presentation. Hypnosis. Hypnosis is a condition of focused attention and increased suggestibility that occurs in the context of a special hypnotist-subject relationship. Hypnosis is not some form of mind control. In fact, hypnosis cannot work unless the subject is open to the idea and allows the hypnotist to hypnotize them. The first person to practice hypnosis was Austrian physician Franz Anton Mesmer during the 18th century. He often used hypnosis in treating patients by passing a magnet across their bodies to redirect the flow of blood, amongst other things. Although doing nothing more than this, many of his patients reported improvement in their conditions, though the validity of its success is in question. Although it is mainly used by performers and people of that nature, hypnosis can actually be used as an effective way to inhibit pain. In fact, hypnosis has been used in the past as a form of anesthesia during major surgeries. In fact, during the Civil War, doctors would sometimes hypnotize soldiers about to receive amputations in an effort to reduce pain. If one were to do a study on the effects of hypnosis, you might measure the number of participants that reported improvements in psychological conditions such as anxiety, depression, etc. Intelligence tests. With something such as intelligence being such a broad subject, one single test cannot determine the full extent of one's intellect. Instead, tests tend to focus on a specific area of intelligence. Probably the most widely known of these tests is the intelligence quotient, or IQ test. This measures the potential academic success of the subject. The original IQ test was soon modified for English speakers by psychologists at Stanford University and what is called the Stanford-Binet IQ test. This test questions are designated by an individual's age, so for an example, an 8-year-old's IQ would be measured against other 8-year-olds. The two other most widely used intelligence tests are the WAIS-4 and the WISC-5. Their developer, David Wessler, formed the test so that the WISC-5 is used for children up to 16 and the WAIS-4 are those for 16 and older. IQ tests are widely used in today's society to try and gauge the academic potential of its participants. If one were to do a study regarding the accuracy of IQ tests, one could measure the GPA of students who scored above average compared to those who scored below average.
Insomnia is when a person does not get enough sleep to feel rested the next day. This can be caused by many factors such as worrying, illness, caffeine, and medical disorders. Sleep apnea, this is whenever people fail to breathe throughout the night while they're sleeping, most common in overweight middle-aged men. Narcolepsy is when people experience sudden attacks of sleepiness during the day. They also have muscle weakness or paralysis and sometimes dream-like experiences while being awake. Sleep abnormalities affect millions of people. Insomnia, for example, not only makes the victim feel tired the next day, but can also increase people's risk for issues such as anxiety and depression. If you were doing a study on negative effects on sleep abnormalities, such as insomnia, you could measure the number of participants that reported increases in symptoms relating to depression compared to those who got an adequate amount of sleep, and those that got more sleep than enough sleep.
And that is our presentation.